Okay, let's dive right in. You wanted us to really get into veterinary retinal detachment in dogs and cats.
Yeah, a critical topic.
Definitely. And based on the sources you pulled together, the specialist guides, research papers, it's clear this is a serious ophthalmological emergency.
It really is, no question. And our goal today, using all this info, is to sort of break it down.
Right.
We want to understand what retinal detachment actually is, why it's such an urgent problem, the different ways it can happen.
Which is interesting in itself.
Totally. And what kicks it off, the underlying causes, how vets diagnose it, the treatment options, and ultimately what gives a pet the best shot at keeping their sight.
Absolutely. And the sources really emphasize starting with the basics, the structure involved. We're talking about two key layers separating at the back of the eye.
That's right. The neurosensory retina and the retinal pigment epithelium, the RPE.
Okay, so the neurosensory retina, that's like the film in a camera, where the light detecting cells are.
Exactly. That's where the photoreceptors live, the rods and cones. And the RPE. That's the absolutely essential support layer sitting right behind it.
Support layer, meaning it feeds the retina.
Pretty much. It provides vital metabolic support, nutrients, oxygen, all that stuff to those photoreceptor cells. It gets that support from blood vessels in the layer underneath, the choroid.
So when the neurosensory bit peels away from the RPE,
That connection,
yeah,
that lifeline, is broken, severed.
and a space opens up between them, the subretinal space.
Precisely. And fluid or blood or inflammatory gunk can fill that potential space.
So it's not just that they're physically apart.
No, it's that the photoreceptors lose their vital support. They start to, well, starve.
And the sources say they don't last long like that.
They degenerate fast, really fast. That rapid cell death is exactly why it's an emergency, why getting help quickly is crucial to prevent irreversible blindness.
Okay, so the layers separate, the cells are in trouble. Got it. But a key point from the sources was that detachments aren't all the same, right? The how matters.
Definitely. It's fascinating, actually. Vets classify them based on how that fluid gets under the retina and, importantly, whether or not there's a physical tear.
All right, let's tackle the one with the tear first. Rhegmatogenous retinal detachment,
Yeah.
RRD.
RRD, yeah. So this type needs a full thickness break, like a hole or tear, in the neurosensory retina itself.
Okay, a tear.
But that's not all. The key thing here is you also usually need something wrong with the vitreous humor, that jelly stuff filling the eye.
Ah, the jelly.
If that vitreous becomes more liquid, they call it syneresis, basically the gel gets watery, then that liquid can seep through the retinal tear.
And get underneath.
Exactly. And it peels the retina off the back wall, kind of like, I don't know, wet wallpaper.
So you need the tear and the leaky vitreous. What causes those things, the tear or the vitreous problem?
Well, the sources point to a few things. Just age-related changes in the vitreous, trauma to the eye, complications after eye surgery.
Like cataract surgery.
Especially cataract surgery, yeah, if the vitreous gets disturbed. Or sometimes there are underlying retinal problems like congenital weaknesses or dysplasia that make tears more likely.
And if a vet looks inside, what does RD look like?
It's often described as bullous, like a big bubble or balloon lifting off, or sometimes undulating, kind of wavy.
And the outlook, prognosis.
It's generally guarded because you've got that structural break, but the sources do say it can potentially be fixed with surgery if the retina itself is still alive and functional.
Which brings us to testing that function later, I guess. Okay, second main type, exudative or serous retinal detachment.
Right. Now, this one's completely different. No primary tear involved here.
No tear. So how does the fluid get underneath?
It leaks. The subretinal space fills up with fluid. Could be inflammatory exudate, could be watery transudate from pressure changes, could even be blood. This fluid leaks out from blood vessels, usually in the choroid, sometimes the retina itself.
Why do the vessels start leaking?
Because the blood-retinal barrier breaks down. Think of it like a seal around the vessels. It's supposed to keep fluid in. When that barrier fails, stuff leaks out.
Ah, okay, so it's a leaky pipe problem, not a hole-in-the-wall problem. And the sources really stress that the causes for this type are often systemic, right? Affecting the whole body.
Exactly. This is a really critical point for you to grasp. Systemic hypertension, plain old high blood pressure, is a huge cause of these exudative detachments, especially acute bilateral ones in cats. It's super common.
Wow, okay. High blood pressure. What else?
Inflammation is another big one. Chorioretinitis, inflammation of the choroid and retina. That can be from infections like fungal or protozoal diseases, or immune system problems attacking the eye.
Okay.
Then you've got things like bleeding disorders, coagulopathies, or conditions where the blood gets too thick, hyperviscosity syndromes. And even tumors growing in or spreading to the choroid can cause leakage.
And how does this exudative type look different inside the eye compared to the bubbly RRD?
It's usually smoother, more like a smooth dome-shaped elevation. It might cover a large area, and sometimes it can even shift a bit if the animal moves its head.
What about the prognosis for this exudative type? You said RRD was guarded?
Often much better for vision, actually. If, and this is a big if you can find and treat the underlying cause quickly.
Ah,
If it's acute, caught early, and the cause responds to treatment, the fluid can resolve before the photoreceptors die off. Vision can come back. It's a massive difference from RRD.
that's a really key distinction.
Mhm.
Okay, third type, tractional retinal detachment.
Tractional. This one's about pulling. Abnormal bands or membranes form inside the eye, basically like internal scar tissue.
Scar tissue.
Yeah, often from inflammation or bleeding. These membranes contract, they shrink, and they physically pull the retina away from the back wall.
So no tear initially here either, but it's being pulled off.
Exactly. No initial tear, but the pulling itself can sometimes cause a secondary tear later on.
What causes that scar tissue to form in the first place?
Usually things like severe long-term inflammation inside the eye uveitis, or significant bleeding inside the eye that organizes into fibrous tissue. Trauma can also lead to scarring. The sources do note that advanced diabetic retinopathy, a major cause in people, is pretty rare in our pets.
And the appearance. What does tractional detachment look like?
Often more localized, maybe pulled into a tent shape. You might see folds radiating out from the point where the scar tissue is yanking on the retina.
Prognosis here.
Generally challenging. Vision prognosis is often guarded, and fixing it usually requires pretty complex surgery.
Okay. And the sources mention hemorrhagic and traumatic types too, but they sound like they fit within these other categories.
That's a good way to put it. Hemorrhagic is basically an exudative detachment where the main fluid leaking is blood.
Mhm.
And traumatic injury can cause any type ROD from a tear, exudative from inflammation or bleeding, or tractional from scarring later on. Depends on the injury.
Right. Okay, so we've got the what's and the different hows. Now let's link this to the why. The sources kept saying retinal detachment is rarely the main issue itself.
Absolutely critical insight. It's almost always a symptom or a consequence of something else going on, either somewhere else in the body systemic or within the eye itself ocular.
Let's dig into those systemic causes first. You mentioned high blood pressure already as a big one.
Systemic hypertension. Can't emphasize it enough, especially in older cats. The sources link it strongly to things like chronic kidney disease, hypothyroidism.
Right.
That high pressure damages the tiny blood vessels in the choroid and retina, making them leaky. Boom, exudative detachment. It's the classic cause of sudden, often bilateral blindness in cats.
What other body-wide problems can show up in the eye like this?
Infections are definitely up there. Fungal diseases, blasto, coccidioidomycosis, things like that, protozoa like toxoplasma, especially in cats. Some viruses FIP in cats, distemper in dogs, even bacteria sometimes.
How do infections cause it?
They cause inflammation in the back of the eye, chorioretinitis. That inflammation damages the blood-retinal barrier, causes fluid leakage, exudative detachment again.
And immune system issues.
Yep. Conditions where the body's immune system goes haywire and attacks its own tissues. Things like uveodermatologic syndrome in dogs, or sometimes just idiopathic inflammation where we don't find a specific cause. Again, inflammation leads to exudative or sometimes tractional detachments down the line.
Bleeding disorders were mentioned too.
Correct. Anything that stops blood from clotting properly, like rat bait toxicity or low platelet counts, that can cause bleeding directly under the retina, a hemorrhagic exudative detachment. Also, conditions that make the blood really thick, like certain cancers, can mess with blood flow and cause leaks.
And cancer itself. Tumors.
Yeah, either tumors starting in the eye or, more commonly, cancer spreading to the eye from somewhere else. Lymphoma, carcinoma. They can infiltrate the choroid, cause massive inflammation, and lead to exudative detachment. Rarely, you can get eye changes from tumors elsewhere in the body, called paraneoplastic syndromes.
Okay, that covers a lot of systemic triggers. What about problems starting within the eye itself? Trauma seems obvious.
Yeah, blunt force, something penetrating the eye,
Yeah.
can cause tears, bleeding, severe inflammation. Any of those could lead to detachment. High pressure inside the eye from glaucoma can also cause damage and detachment over time.
And uveitis, that internal eye inflammation, seems to pop up everywhere.
It's a huge player.
Yeah.
Chronic or severe uveitis is a major cause. It breaks down that blood-retinal barrier, causing exudation, and the inflammation itself can lead to scarring and tractional detachment. Even a dislocated lens luxation can physically irritate things or mess with the vitreous, potentially causing RRD.
You mentioned vitreous degeneration and retinal dysplasia earlier too,
hmm
linking them to RRD and breed issues.
Exactly. This is where genetics comes in. That vitreous degeneration syneresis where the jelly gets watery. Some breeds, like Shih Tzus, Boston Terriers, Italian Greyhounds, seem prone to inherited vitreous problems where it pulls abnormally on the retina, causing tears and RRD, sometimes seemingly out of the blue.
And dysplasia.
Retinal dysplasia means the retina didn't develop correctly from birth. It can range from tiny folds to large areas that just never attach properly. Breeds like Springer Spaniels, Labs, Cavaliers, Collies, especially with Collie eye anomaly, are known for this. It might cause blindness right away, or just make them more likely to detach later.
What about complications after eye surgery, like cataract removal?
Yes, that's a known risk, particularly if the vitreous is involved or disturbed during the operation. And way down the line, in end-stage inherited diseases like progressive retinal atrophy, PRA, the retina can get so thin it actually develops holes, which could lead to an RRD.
Any other purely ocular causes the sources mentioned?
A few others. Developmental issues like colobomas, missing bits of tissue, like in Collie eye anomaly. Certain metabolic things like really high cholesterol in dogs. Sometimes, even after looking for everything, the cause just remains unknown idiopathic, though they did mention a specific steroid-responsive type in some giant dog breeds. And very, very rarely, maybe a weird reaction to a drug. It's a massive list, isn't it?
It really shows how the eye is connected to everything else. So, okay, for the owner,
Yeah.
what are the red flags? What might you actually see at home?
Often it seems very sudden, especially if both eyes go at once. Sudden blindness is probably the #1 thing owners report.
Like bumping into furniture.
Exactly. Bumping into things, seeming hesitant on stairs, maybe acting disoriented or anxious, even in familiar places.
Yeah.
Just not seeing well suddenly.
And if you look closely at their eyes,
The pupils, you'll often notice they're really wide open, dilated. And they might not shrink down properly or at all when you shine a light on them. If it's just one eye, the pupils might look different sizes. That's anisocoria.
and then what the vet sees during the exam is key.
Oh, absolutely crucial for diagnosis. Using their ophthalmoscope, the vet looks right at the back. Instead of seeing a flat retina against the back wall, they'll see it lifted up. It might look opaque, cloudy.
And different depending on the type.
Yeah, maybe wavy and bullous, like those bubbles in RRD, or smoother in dome-like and exudative cases. The blood vessels on the retina will look like they're riding up on the detached part, maybe looking twisted or tortuous.
Can they see the fluid?
Sometimes, yeah. They might see the fluid or blood or exudate pooled underneath. If they suspect RRD, they'll be hunting for those little red defects in the tears themselves. Plus, they might see other clues like signs of inflammation in the vitreous or changes suggesting chorioretinitis. There's even a condition, canine multifocal retinopathy, where you might see specific Grayton spots before a full detachment happens.
Seeing those changes is step one. So once a vet suspects detachment, what's the diagnostic game plan? How do they figure out the why and the prognosis?
Speed and thoroughness are everything here. You need a rapid workup to have a shot at saving vision. It starts with that complete eye exam, getting the history, checking pupil responses, testing vision with things like maze tests or tracking cotton balls.
And that look at the back of the eye, the Fendick exam.
Absolutely non-negotiable. Using direct or indirect ophthalmoscopy to see how much is detached, what type it looks like, bullous, smooth, tented, and searching carefully for any tears. They also check the eye pressure with tonometry. It could be normal, low if there's inflammation, or high if secondary glaucoma has set in.
But what if they can't see back there? Say there's a dense cataract or lots of blood obscuring the view.
Ah, great point. This is where ocular ultrasound, specifically B-scan ultrasound, becomes absolutely essential. The sources really highlight this
Why is it so key?
because it uses sound waves to see through the cloudy stuff. It lets the vet visualize the detached retina, see its shape, what's underneath it, even when they can't see it directly with a light. It's also vital for telling a true detachment apart from, say, membranes in the vitreous.
Okay, so ultrasound sees through the haze. Now, before thinking about treatment, especially surgery, there's that mandatory test you mentioned.
Yes. The electroretinogram, or ERG, this measures the electrical response of the retina to light. Basically tells you if the photoreceptors are still working.
Why is that mandatory?
Because if the ERG is flat or very low, it means the photoreceptors are already dead or dying beyond recovery. Surgically sticking the retina back on won't bring vision back in that case, so surgery for vision would be pointless. It also helps rule out other causes of sudden blindness, like SARDS, which has a different ERG result.
Got it. Ultrasound to see if it's detached, ERG to see if it's functional.
I got it. And then because so many detachments stem from systemic
You
problems.
need the whole body workup.
Exactly.
Oh.
Indispensable, starting with blood pressure.
Especially in cats.
Crucial in cats presenting with sudden blindness. Hypertension is just so common. It's often one of the very first tests. Then standard blood tests, CBC, chemistry panel, urinalysis looking for inflammation, kidney problems, liver issues, metabolic stuff, weird blood cell counts.
And if they suspect something specific, like an infection,
Then they'll run more targeted tests. Thyroid hormone levels in older cats. Specific antibody titers for infectious diseases common in the area. Maybe a clotting profile if bleeding's a concern. Sometimes imaging like chest x-rays or an abdominal ultrasound to look for cancer or signs of systemic inflammation. And for certain breeds, genetic tests might be relevant.
the sources mentioned potentially sampling eye fluid or spinal fluid, but that sounds riskier.
It is riskier, yeah. Usually reserved for really tricky cases where they strongly suspect an infection or maybe cancer inside the eye or brain, and other tests haven't given them the answer.
Okay, quite a process to nail down the why.
Yeah.
So how does the treatment plan follow from that diagnosis?
It depends completely on the underlying cause,
Yeah.
the type of detachment found. You absolutely have to treat the root cause, otherwise just dealing with the detachment itself won't work long term.
So for those exudative types, often linked to systemic issues, medical management is the way to go first.
Precisely. Treating the underlying disease is job one. If it's high blood pressure, you use antihypertensives. Amlodipine works great in cats. Drugs like enalapril or benazepril are options for dogs and cats too. But you have to monitor the blood pressure closely.
And if it's inflammation or infection?
Then you use the right drugs for that systemic anti-inflammatories, like steroids. But carefully, you need to rule out or treat fungal infections first, or specific antibiotics, antifungals, or antiparasitics. If it's immune-mediated, they might need steroids or other immunosuppressants, possibly long-term.
What about treating bleeding disorders or cancer found during the workup?
Same principle, treat the primary problem. Give vitamin K for rat bait poisoning, maybe plasma transfusions. For cancer, it could be chemo, radiation, surgery, whatever's appropriate for that specific cancer.
Are there eye-specific medications used alongside this systemic treatment?
Oh, yeah. Often they'll use topical eye drops, anti-inflammatory drops, steroids or NSAIDs, to control the uveitis that often accompanies detachment. And usually mydriatics, like atropine, to dilate the pupil. That helps with pain, prevents the iris sticking down, and makes exams easier. If the eye pressure goes up, secondary glaucoma, they'll need drops to lower that too.
Okay, so medical management for the systemic stuff, when does surgery come into play?
Surgery is mainly for the rhegmacogenous detachments, the ones with tears and maybe some really complex tractional ones. But again, only if the ERG shows the retina is still functional, still has a chance to see again.
And it's specialized surgery.
Definitely. Done by veterinary ophthalmologists, it's complex stuff.
What kinds of things do they do in surgery?
Several techniques. One is vitrectomy, going inside the eye to remove the vitreous jelly, especially if it's pulling on the retina or full of blood or inflammatory debris. Another is scleral buckling, putting a band around the outside of the eyeball to gently push the wall inwards, bringing the arpechoroid closer to the detached retina.
And sealing the tears.
Right, that's retinopexy. Using either a laser or cryotherapy, freezing, to create tiny adhesion points, like spot welds, around the tears or detached areas to help seal the retina down. Often they'll combine these techniques. Sometimes they drain the fluid from underneath during the surgery too.
Sounds pretty involved. I bet recovery is intense.
Absolutely. Strict cage rest, lots of different eye drops and maybe oral meds, and very frequent follow-up appointments are crucial for success. And importantly, owners need to be prepared to adapt the home environment if the pet ends up with permanent vision loss.
So after all this diagnosis, maybe complex treatment, what's the bottom line? What's the realistic prognosis for vision?
It's highly variable. The sources make it clear that several factors really influence the outcome.
Like the underlying cause, does that matter most?
It makes a massive difference. If you have a treatable systemic cause, like hypertension that you get under control quickly, the prognosis for vision returning can actually be pretty good. Much better than, say, a severe untreatable infection or a really chronic RD with lots of scarring.
And does timing matter? How quickly it's treated?
Hugely important. Time is vision. An acute detachment caught within days has a much better chance than one that's been there for weeks. Those photoreceptors just don't survive long when they're detached. The damage becomes irreversible quite quickly.
What about how much the retina is affected?
Generally, yes. A partial or focal detachment usually has a better outlook than a complete 360-degree detachment. And specifically, if the detachment involves the area centralis, the spot responsible for the sharpest vision, the prognosis for good visual recovery is worse, even if it reattaches.
And this comes back to the ERG again.
Fundamentally, a positive ERG result before treatment is essential. It means the cells are still alive and capable of functioning if reattached. A flat ERG means, sadly, that vision won't return to that eye, regardless of treatment.
Any other complicating factors?
Yeah. Other problems in the eye at the same time definitely worsen the prognosis. Things like significant bleeding inside the eye, hyphema, severe uncontrolled uveitis or secondary glaucoma, and ultimately how well the pet responds to the chosen treatment, medical or surgical, is key.
Do they usually get perfect vision back if it works?
The sources suggest that even with successful reattachment, some degree of residual visual deficit or ongoing degeneration is common. Maybe not perfect 20/20 vision, but the exception is often that acute hypertensive retinopathy in cats. If caught and treated super fast, vision can sometimes return remarkably well.
Is there anything owners can do to prevent retinal detachment in the first place?
Prevention mostly boils down to managing those underlying risk factors. Regular vet checkups are key, especially for older pets.
Why?
To screen for those sneaky systemic diseases, high blood pressure, kidney disease, hyperthyroidism before they cause irreversible eye damage. Early detection and management is huge.
What about breeds that are prone to it?
Genetic screening is important there. For breeds known for inherited retinal dysplasias or vitreous issues, screening breeding animals can help reduce the incidence. Basic stuff like avoiding eye trauma is obvious. And for vets doing eye surgery, especially cataract surgery, being really careful to minimize disturbing the vitreous can help prevent post-op detachments.
Okay. Lastly, the sources mentioned some key differences between dogs and cats. What stood out?
The biggest one, we've hit on it a few times, is systemic hypertension. It is way more common as a cause of acute bilateral exudative detachments in cats, often tied to their kidney or thyroid problems, than it typically is in dogs.
And dogs.
In dogs, while hypertension certainly occurs, you see inherited issues perhaps more often as the primary driver, especially things like vitreous abnormalities leading to RRD in specific breeds. Also, taurine deficiency used to be a thing in cats causing retinal problems, but modern diets have made that really rare.
Surgery differences.
The techniques themselves are similar, but why an animal might need surgery, the common indications, differ a bit between the species, reflecting those different underlying causes.
Wow. Okay. This deep dive really hammered home that retinal detachment isn't just one thing. It's a complex sign, a symptom, that can pop up from a whole host of other issues, both body-wide and just in the eye.
Absolutely. And understanding those different mechanisms, rhegmatogenous, exudative, tractional, and the critical role of diagnostics like ultrasound when the view is blocked, and the ERG for function, plus realizing that treatment hinges on finding and managing the underlying cause. That's really the core message from the sources you provided.
It definitely makes you appreciate the detective work vets have to do, and why acting fast with a full workup is so incredibly important for potentially saving a pet's sight.
Yeah. And it leaves you with a fascinating thought, doesn't it? Given how often the eye acts as a window, showing us clear signs of systemic disease happening elsewhere, like with hypertension causing blindness. What does that really tell us about the incredible and sometimes really unexpected interconnectedness of health issues throughout a pet's entire body? The eye isn't just for seeing, it's seeing into the pet's overall health.